Okay, this video is called Why Are Kidney Failure Patients So Stupid? And another name possibly for this video would be why do kidney failure patients have so many arterial calcifications? So here'd be like a typical CAT scan of a kidney failure patient. Notice there's extensive atherosclerotic calcifications all along the abdominal aorta, as well as the branch arteries, coming off the splenic artery, the renal arteries, superior mesenteric artery, the common iliac artery, external iliac artery, common femoral, etc. There's calcifications everywhere. When I see a CAT scan of the brain, I'll often see the external carotid arteries completely calcified bilateral. As soon as I see that, I know the patient almost certainly has end-stage kidney failure. Kidney failure can be staged by measuring something called the GFR, glomerular filtration rate. Most important number to know is 60. When they're below 60, that means they're stage 3 kidney failure. You can think of this filling level within a kidney drawing here is the amount of urine the kidney is able to excrete and filter and clear. Okay, so the lower this goes, the less the kidney is able to clear, let's say, per minute. All right, so once they get below 60, they start having problems, and we start getting concerned about them. When it gets below 30, we won't even give them IV contrast on a routine basis for CAT scans or for MRIs. By the time they start getting down even lower, like 15, they're going to be put on dialysis. Dialysis is pretty miserable. It's like 3 days a week for, like 5 hours at a time. It's quite miserable. And so you say, why do they get kidney failure? Well, for the same reasons people get almost all the Western diseases. They get fat, they get diabetes, they get hypertension, and that starts destroying their arteries, plugging up their arteries, worsening their atherosclerosis. And the kidney failure patients in particular, they have very poor cognitive function. Like I said, the stupidest patients I meet on a routine basis are kidney failure patients are the worst. Number 2 would be diabetics. Number 3 would be obstructive sleep apnea patients. Okay, here's just some articles showing you what's going on. Vascular calcification and chronic kidney disease is highly prevalent. Yeah, it's almost like they go together. And, other things associated with kidney failure, they have increased hyperphosphatemia, hypercalcemia. The bizarre thing is the vascular smooth muscle cells, they become transformed into an osteogenic phenotype. What that means is they start making calcification like making bone, like bone-forming cells. It's crazy and bizarre, but that's what happens. Vascular calcification and chronic kidney disease, another paper showing the same thing. So here's a normal artery with vascular smooth muscle cells. You need vascular smooth muscle cells. They're contractile cells. They're a muscle cell. They contract to maintain the proper diameter of the artery. The artery should be a functional structure. It's not just a pipe, a hard, rigid pipe. It expands and contracts in proportion to the need for blood flow to the adjacent tissues. So what I'm also saying here is a kidney failure patient loses the ability to precisely regulate the amount of blood flow going to their tissues. They have decreased autoregulation of that. And these are all the things that damage it and predispose to arterial calcification. Elevated phosphate, inflammation, reactive oxygen species, oxidative stress, uremic toxins, and advanced glycation end products. That's all, like diabetes right there. They also have a problem with something called phytuin A, which is related to, it's kind of similar to albumin in some of its properties. It's a blood carrier protein related to calcium and phosphate, and also to lipids. So there's more. We're just sort of getting warmed up here. Okay, here's more things that go bad. And why am I showing you this? Because this is super common. I see this numerous times every single day. And it's caused by the same thing that caused almost everything else. Obesity, hypertension, and diabetes are the gateway diseases, and they cause atherosclerosis, and they plug up arteries all throughout the body. This is why the proper attitude towards a low-fat, low-sodium vegan diet is, thank God, there's something I can do. I'm not inevitably screwed. Okay, because the other patients are. I mean, whenever I hear the name patient in the Western world, in any Western hospital, over 55, and especially over 60, I automatically think they're overweight, they're diabetic, or pre-diabetic, hypertensive, and they're cognitively slow. Because that's how they almost always are. I mean, there's some rare exceptions, but that's how most of them are. And the other thing, people say, oh, well, why are you, making fun of stupid people and stuff? The reason is stupid people get sick all the time. Okay, an intelligent person, like somebody who becomes a low-fat, low-sodium vegan, they hardly ever get sick, so you don't see them that much. In a hospital, doctors all see a lot of stupid, bad behaved patients all day long every day because they're always sick. You know, alcoholics are always sick. Cigarette smokers are always sick. Okay, drug addicts are always sick. All right. All right, so here's some other things. Chronic kidney disease and venous thromboembolism. So venous thromboembolism, VTE, that means either a DVT, deep vein thrombosis, or a PE, pulmonary embolism, a clot in a leg vein. This is a clot moving from a leg vein up into the pulmonary arteries of the chest, okay? So basically, kidney failure predisposes to clotting. It does a bunch of bad things to your physiology. Even mild kidney failure is associated with elevation of blood clotting factors, including factor 7, factor 8, and fibrinogen. So it predisposes you to clotting. In addition, it causes increased platelet activation. It stimulates the platelets, which means makes them more predisposed to clotting. And then the loss of the albumin carrier protein in the blood means that you get more thromboxane A2, something made from arachidonic acid, to be active in the blood, and that also will predispose to clotting and the vasoconstriction. So everything is going in the wrong direction. The arteries are tightening up and they're clotting up, okay? Nephrotic syndrome means loss of protein in the urine. It's very common. It's also associated with hyperlipidemia. The liver compensates for the loss of albumin proteins in the blood by making more lipoproteins. So you get hyperlipidemia. You get elevated blood cholesterol and elevated blood triglycerides. Okay, just a quick summary, little slides here. So, you know, the increased hyperlipidemia also makes the blood more prothrombotic, more disposed to clotting. The increased thromboxane A2 activating the platelets makes the blood more predisposed to clotting. We know that a predisposition to increased platelet activation will cover up metastasizing cells, so it's going to increase the risk of metastatic cancer. It's all bad. Okay, and so what do you do to treat it? You do what, you know, Walter Kempner did way back in the 1930s, 40s, 50s, and 60s. It's been known for a long time. You put the patient on a low-protein diet because the main thing the kidneys do is excrete protein. So you give the kidney a vacation in a sense. It's about 75% of their workload. And that helps the kidney to recover, to stabilize, to be able to do the other things it needs to do. A low sodium diet is also preferable to reduce water retention because when you're having nephrotic syndrome and you're excreting out your albumin, that maintains the osmotic or oncotic pressure, you can call it, in the blood to prevent extravascular swelling. So one symptom of low albumin, because you're pissing it out through the kidneys with nephrotic syndrome, is to have swelling of one's ankles. So you can get swelling of the ankles bilateral with congestive heart failure. You can also get it from hypoalbuminemia due to excessive loss of that albumin protein in the kidneys with kidney failure. So the bottom line is you want to prevent kidney failure. And again, what are the gateway diseases? Obesity, hypertension, and diabetes. Those leading to atherosclerosis. Those plugging up arteries in the kidney. That causing ischemia, lack of oxygen and glucose delivery to kidney cells with resultant kidney failure. So anyways, I just thought that was a little interesting to explain why these kidney failures have so many arterial calcifications associated with atherosclerosis, loss of autoregulatory control of arterial diameter in small vessels, and with resultant massive decrease in cognitive function.